Good day and welcome again to our channel. Thank you so much for tuning in. Dr. Kehinde Elisha speaking here, founder of FNP Certification Academy. Today, I'm going to be breaking down some DSM-5 diagnosis questions and to see if you're going to be able to connect with it, especially if you're already struggling with it. If you have ADD, ADHD, and an heightened level of anxiety, my technique, I hope, is going to bring things home for you. Now, we have more than 450 questions that we normally break down for students, or that we analyze, or that we set up in our canvas for students. So we're just going to touch up on a few of them today and see if that's your learning style. You're going to see me breaking down according to the, disorders, pretty much. We're going to talk about neurodevelopmental disorders, some depressive disorders, some, bipolar disorders. Well, I'll see how many questions I can really get to today. But the most important thing is for me to help you connect on how to really analyze these questions and see it on the exam, so you don't run out of time. A lot of students complain about time management and all that. It all begins right here. It depends on what can you see and how fast can you see it. Those are some of the techniques that, play a part in your time management. www.npcertificationacademy.com is our website if you want to connect with us, or you can reach out 347-901-6037, studentcoach@gmail.com, or info@npcertificationacademy.com. At this time, I'm going to go ahead and get started with the very first question here. So get your paper ready and be ready to highlight keywords. Be ready to, take your time to read it if I'm too fast for you. So look, it's a 6-year-old boy. 6-year-old boy keyword is brought into the clinic by his parent. His parent is also a keyword due to concerns about his behavior. His behavior is a keyword. The child rarely makes eye contact, major keyword. Prefers to play alone and often repeats the same phrases out of context. During the assessment, the provider observes the child flapping his hands repetitively. Keyword, flapping his hands repetitively and lining up toys in a specific order. So these are things that you're going to have to put together to make, your case. His language is delayed and he struggles with engaging in back and forth conversation. And of course, there is no history of seizures. Developmental milestones were delayed. What is the most likely diagnosis? So listen, it's a 6-year-old boy brought to the clinic by parent. They are concerned about this kid's behavior. It doesn't make eye contact. It likes to play alone. And of course, sometimes when we talk, it repeats the same thing, right? Now, the provider also observes some things. This is an objective data now, with flapping his hands repetitively and lining up toys in a specific order. His language is delayed and he struggles with engaging in back and forth conversation. He just gets tired. Like, this is communication issues here, right? Now, there is no history of seizures. Developmental milestones are delayed. What is the most likely diagnosis? A, attention deficit hyperactivity disorder. B, autism spectrum disorder. C, specific learning disorder. D, intellectual disability. First, let us dissect this question. If you absolutely have to read this question twice, do you really see you reading it for 30 seconds? Absolutely not. Because listen, on that exam, you have 1 minute per question. You have to read this for 30 seconds and read this for 30 seconds. At NP Certification Academy, we teach you the skills necessary to beat that time. If anything, to be on time so that you are not struggling to catch up with your tests. So now, how should you be approaching this? Now, you want to go ahead and remove the 2 answers that you know that is definitely not. Okay, so I know it's not going to be learning disorder. It's more than that. I removed that. I know this kid is not disabled. The question also said it, okay? That we don't have anything like that going on. So 2 is out. Now we have A and B left. Listen, it is better to have 2 problems than 4 problems. Now, 4 options means 4 problems. 2 options means 2 problems. So now I have A and B to go back and forth with. Now, if I have to go back and forth between 2 things, it's better than going back and forth between 4 things. I'm also saving time that way. So now I have attention deficit hyperactivity disorder here. Well, I don't really see anything in the question that that's going to help me conclude on that. So I can confidently remove that too. Now I have autism spectrum disorder that is left, and that is the final answer. I really, really hope that you were able to also nail down this question. Of course, it looks a little bit easier. Hopefully, we're going to run into some conduct issues that is a little bit more critical thinking. But how should we be breaking this down? Let's talk about the rationale table here. ADHD, what are we looking for? ADHD generally does not include social communication problem. If anything, they are the funny ones in a crowd. They are the ones that, joke around. They don't sit still. They are like pretty much social beings, I'll say. And they don't have repetitive behaviors. They don't have restricted interest. Those throw ADHD out of the, that's why it's out of the window right there. However, what are the key features of ADHD though? It is inattention, impulsivity, and hyperactivity. And these were not mentioned, like I said earlier. What about autism spectrum disorder? Yeah, that is the perfect answer because they do have social deficit. They cannot make eye contact, or they have a very poor eye contact. They like to play alone or be alone. They have communication delays. And for example, something they're supposed to communicate on Monday, they won't be able to communicate it until Friday, when everybody already forgot about the issue. This is reality, okay, for those with autism. They also have restricted and repetitive behaviors like echolalia, toy lining, or lining up toys, and hand flapping. And these are hallmark features of autism spectrum disorder. Now, they lack eye contact. Of course, they have repetitive behaviors. They have language. Those are the other key symptoms that I mentioned earlier as well. Now, what about specific learning disorder? We are not picking this mainly because the question didn't say anything about having academic difficulties, right? Academic challenges only. That's all they have a problem in. They just can't learn. What about intellectual disability? It's incorrect because while ID involves global developmental delays, it must include significantly below average IQ and adaptive functioning across multiple areas. No mention of IQ or global adaptive deficit here. So adaptive functioning and intellectual deficits not clearly demonstrated here. So that is why it is not. So what about the key content that we have to review to really do well on this question? Remember, I always say there are no strategies without content. And that is absolutely correct. So we must understand the content first before we can even eliminate. Listen, process of elimination only work with what? With content. So we must understand what, ASD present as. We must understand what ADHD look like, what ID look like, what, communication disorder look like, motor disorder. We must understand this content. These are the common core features of the same question that we got. We have to be able to separate all of this and not mix it up on the exam. So what is the test taking strategy tip? You got to look for functional impairment. You got to watch for early onset and developmental history. We got to be able to eliminate core criteria and focus on the hallmark behavior. So now the hallmark behaviors that we saw in the earlier vignette is that we have hand flapping, echolalia, lining up toys. These are classic for autism spectrum disorder. Dr. Kehinde Elisha speaking here, founder and CEO of FNP Certification Academy. Are you really enjoying my questions right now? We do also have these questions for sale. If that's all you want to take from us, if you want to, grab our question with this detailed strategy, of course, just visit www.npcertificationacademy.com. That is www.npcertificationacademy.com. We're now going to move on to the next question. Now, question 2. What is this case about? It's talking about a 9-year-old patient brought into the clinic by his mother due to persistent behavior problems at home and school. Over the past 6 months, he has frequently argued with adults, refused to follow rules, deliberately annoyed his siblings, and blamed others for his mistakes. Listen, teachers report that he loses his temper easily and is often angry and resentful. There is no evidence of physical aggression, property destruction, or cruelty to animals. Now, when they say there is no evidence, you have to believe in it. Listen, they already said there is no evidence, and they put that in for a reason. They're trying to tell you that, hey, listen, it is not what you're thinking right now because it doesn't exist in this person. Okay, listen. So they said there is no evidence of physical aggression. There is no evidence of property destruction. There is no evidence of cruelty to animals. Listen, they are trying to rule out conduct. I say, hey, listen, it is not conduct, okay? So his academic performance is average. What is the most likely diagnosis? Now, based on what they said, when they said there is no evidence, what are you going to take out? Of course, you want to go ahead and eliminate conduct first, period. You want to go ahead and remove that. That is what they are trying to tell you here. Now, we have other options to look at. Intermittent explosive disorder, oppositional defiance disorder, attention deficit hyperactivity disorder. Providers, tell me, drop your answers in the chat. What do you think the answer is? 1 minute. All right, fast forward. Our 1 minute is now over. What is the answer now? We know the answer is going to be what? It is not IED. Okay. Well, first of all, let's start with A. We said it's not conduct. We already said that because there is no evidence of the things that will make it conduct. So A is out. All right, we know it's not IED because it didn't say that the patient have an explosive anger. Okay, so that is out. C, we're going to go ahead and hold on to that. We know it's not D. Nothing tells us the patient is, hyperactive or impulsive. Nothing here is really saying that. So we know the final answer is going to be C. Oppositional defiant disorder. Now, what can really clue us to C? Now, argued with adults. Listen, ODD, they use their mouth. Conduct, they will use their hands. Listen, ODD, they will use their mouth to argue. They argue a lot. That is one of the hallmark for it, argumentative. So a lot of times we have to do some kind of parental training skills to bring them to order. What about conduct though? They use their hands, listen, to be aggressive, property destruction, cruelty to animals. They are using their hands to do all those things. We also need to keep some things in mind. That ODD is the beginning of the behavior, then lead to conduct. From conduct, then we get to what? Antisocial PD after 18 years old. So whenever we hit conduct, we have to do what we can, hopefully, to not let them advance and find a way to continue to train them and guide them in the right way before it gets out of hand. But to be honest, conduct is already late. ODD is where we need to tame them down and make sure it doesn't get to conduct. So we know the final answer is C, as discussed earlier. So now, let's now look at what rationale look like. I hope you like the way the rationales are laid out. And of course, it's meant for students that really, really want to grab all that content with them. And it's kind of clean, you know what I mean? You're not only learning the correct answer, you are also learning how to, understand other concepts. So let's take a look now. Why is it not conduct? It is incorrect because that one is focused mainly on, serious violations of other rights like aggression, destruction, and theft and cruelty to animals. That is conduct. They are using their hands to beat people, to do bad things to people, to steal things. That is a conduct problem. Now, this usually is below 18 years of age. This child shows defiant, not aggression, and because of the defiant, that is why it falls under the category for ODD. Conduct is aggressive, ODD is not aggressive. Does it make sense? Now, what about IED? It is incorrect. Why is it not correct? Because IED generally will involve what? Impulsive, aggressive outbursts. Usually, their anger is out of proportion to the situation. That is the hallmark. Listen, you have to understand the keywords to identify the psychopathology. That is the way to get through this test. Now, you can't be reading like a novel. There are ways that we teach this diagnosis in our exam review, and you will be able to, it's going to stick with you for life. Listen, there is also life after board exam review. So you really have to know this anyway if you're going to be doing it for life. So now, what about the keywords that we normally see with IED? Explosive, out of proportion anger. It is out of proportion, meaning that it is not at the same level with what happened or with what led to that anger. What about ODD then? It is correct because to be argumentative, to be defiant is the hallmark. It is classic for ODD. Refusal to comply with authority, lasting at least for 6 months. So they argue with adults, they refuse rules, they blame other people, they're angry, and they deliberately annoy other people. Why is it not ADHD? So it's not ADHD because it involves impulsive and poor attention, and it does not include hostility, argumentativeness, or spitefulness. So ADHD is not that negative. If you think about it, the inattentiveness, the impulsivity may look like they are being rude, or maybe they are being stubborn, or maybe they are not doing what you ask them to do. But in reality, they just don't have the capacity to do those things. If you forget, you forget. If somebody forgets their wedding anniversary, they forgot. If somebody forget their keys and they can't find it, they forget. They just can't remember. That's all I can tell you right now. So it might come out like other behaviors, but it is not a behavioral problem. It's something they don't have the ability to control. So now, ODD. The key content review for ODD is you got to know the duration. It goes on for at least 6 months. Symptoms: they're angry, they're irritable, they're very, very argumentative and defiant. In at least one setting, this symptom must be present. And of course, it's one of the easiest one of all, actually. Anyway, what is the test taking strategy tip for this particular question? You want to look for key behavior patterns. You want to rule out aggression or law breaking. Duration matters. You want to differentiate it from ADHD. Extremely, extremely important. Okay, we're now going to go ahead and go to the next question. It's about a 10-year-old child that is brought into the clinic for chronic irritability and frequent temporal outbursts. His parents report that he has severe verbal outrages or physical aggression at least 3 times per week. At least 3 times per week for the past 10 months. That is a lot, okay? 10-year-old, 10 months. Often in response to small triggers. Between outbursts, the child remains irritable, listen, and easily annoyed most of the day, nearly every day. Why? Both at home and in school, okay? Now, excuse me for that. Now, there is no evidence of elevated or expansive mood, grandiosity or flight of ideas. Is sleep and energy are stable between episodes? This symptom started before age 10. Don't you just feel bad for the mom a little bit? I kind of do, okay? I connect with questions like that, but hey, don't get carried away though on the exam. No matter how bad or sad your question sounds, what you want to focus on is what exactly is the question asking me? What exactly is the question asking me? You want to focus on what they're asking you. You want to avoid getting sidetracked. Now, so what is the most likely diagnosis? Providers, listen. A, bipolar disorder. B, oppositional defiant disorder. C, intermittent explosive disorder. D, disruptive mood dysregulation disorder. So first, we're going to rule out some things. This is a 10-year-old. Okay, so we have to keep that in mind. Okay, for IED, we can see it in both children and adults, but I'm ruling that out first because the expansive mood kind of take that out right there. IED is more of a behavioral issue than a mood issue. Okay, similarly, I'm going to take ODD out for similar reason. So I'm going to hold on to the mood problems, A and D. Can you see now? The only reason I know what to hold on to is this, okay? I know what to hold on to mainly because of what? I understand my content, and I know what is a mood problem, and I know what is not a mood problem. So I can see that this is a mood question based on the content that is being presented in the clinical case study. So now I have A and B. So now, it's sounding more like bipolar, but let's think about the age. The mood state that this age group will probably go through is going to be disruptive mood dysregulation disorder. It's so similar. Very, very, very similar to bipolar. In fact, some people call it baby mania, but that is not the right term. There's no term like that. But D is the final answer. I really hope you all agree with me. Let's go into the detailed content or detailed rationale. So, with bipolar disorder, why is it not correct? First of all, it includes distinct manic and hypomanic episode. Don't forget also, there are 4 types of bipolar. Okay, bipolar 1, bipolar 2, hypomania, and of course, cyclothamia. Bipolar 1, bipolar 2, cyclothamia. Am I missing one? So now, there is no mania, there is no elevated mood, there is no grandiosity. Those are the keywords I would say. Now, ODD, why are we not picking that? Argumentative and defiant behavior. These are mostly behavioral issues that we see here. We shouldn't be seeing mood. Okay, why is it not IED? Again, similar to ODD, we shouldn't really be seeing mood. They're going to get some outbursts. They're going to get angry. It's going to be out of proportion to situation, but it's not mood. What about disruptive mood dysregulation disorder? Is perfectly correct. It is chronic or severe irritability with frequent temporal bursts and persistent angry mood between episodes in children ages 6 to 18 with onset before age 10. So the outburst is too frequent. Like, think about it. Outbursts 3 times in a week. A week that we're talking about is 7 days. And it may even be more. That is the minimum that we see. All right. I really, really hope that you like the layout of this question. I really, really hope that you've learned something from this question. We really cannot go through everything. At this time, we're going to go ahead and, round up this content and present our exam review. And if you like to join us, I will guide you quickly on how to book and reserve your spot. Listen, there are no strategies without content. You have to really understand your content, not memorizing anything. How much do you want to memorize? You want to learn this the right way now. It's an see it as exam prep. See it as an opportunity to learn permanently. Okay, so that when you get to that job, you will never have to struggle to do anything like this. Remember the hard pipe process. You can't get to pharmacology unless your diagnosis is right. The ability to actually function on the job, okay, will depend on your ability to also diagnose and assess and interpret results. So that all plays a role in how you really do well, how you do on your job. So I really hope you did well on those questions. If you didn't, please don't be discouraged. We have a lot more questions on diagnosis. We have a lot more questions on assessment, on psychotherapies and theories, roles, leadership, and ethical principles. So this is like a tiny portion of your test. So don't think because you have this is it. No, this is not it. So we look forward to seeing our full review. Just visit what? www.npcertificationacademy.com. That is www.npcertificationacademy.com. We have 99.9% pass rate. You will not regret it, okay? You can also give us a call, 347-901-6037, or email nurse-to-nursecoach@gmail.com to purchase our questions. You can visit our site. We also have flashcards that we sell, so you can also do that if you don't want to join a review. So we have lots of options that you can definitely tap from. All right, I will now quickly give you a tour of our website. Thank you. All right, for now, this is July 24th, 2025. So I want to quickly present our website to you. Maybe this is going to change soon, I don't know, but for right now, this is what it is, okay? So you come in here, our contact is right there, email is right there, and then preferably just do the Gmail, frequently checked. And then, of course, you click on PMHNP, whatever you want to schedule. Click on schedule and booking, and that will guide you on what schedules that we're on. Currently, this is our schedule. We're looking to making some changes to be able to accommodate students to not have to miss work because of a review. But you can also book on this page, okay? So I'm going to quickly go back to where we came from. So now when you get here, we have two types of exams. We have ANCC, we have AANP. ANCC, you click on it, it takes you right to our options. Don't forget, we have a 4-day review. This changed already. We have a 4-day review for $4.99, and we have a 6 weeks review for $7.99. Well, you choose, okay? What suits you best. So some students like to study alone, then I would say go for the 4-day review. But if you want to be connected to that circle of exam success to strengthen you, for you to continue to network with the right people, I would recommend you just stay in the $7.99 and stay in for 6 weeks. You're going to be coming to class for 2 days a week or even 4 days a week if you want to attend other classes. And we have several opportunities for you to attend. You won't really have to worry about missing any session. Now, we have extended package here for students in school or for students that think they will need more than 2 months, so that if they need to extend, they can extend for free. So things are here for you. We have some stuff here for you to read if you need to check it out and see what exactly that we offer. Now, this is AANP. AANP came out last year, 2024. I was privileged to also actually take that test, and I saw the stark difference between how the tests are laid out. So I figured I can support students on how to do well on the exam. Don't forget, no matter whatever support we give, the best support is still the content. So we definitely go through content. We go through everything else too. Whatever we see that we think is high yield, we definitely go through that. But I can tell you right now, there is no review out there that have exam questions. But we get you close to the exam. So you still have to put your time in and do what you have to do to get through. At this time, we're now going to end this video. Thank you so much for tuning in to our channel. Dr. Kende Elisha speaking here, founder of NP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. Come join the circle of exam success. Have a wonderful day. Bye-bye.